Senior Connections, a show about senior issues and events. A guide to active independent living. With your hosts, Margie Toms and Janet Halliday.
Good afternoon. Welcome to Senior Connections. I'm Margie Wimberly Toms.
And I'm Janet Halliday. Today we are going to be talking about hospice. Did you know that there are 72 hospice organizations in the state of South Carolina? Do you know the difference between palliative care and hospice? Well, today you're going to learn the difference and how to choose a hospice that's appropriate for your needs. Our guest today is Sue Woodall. She is the clinical director for Heartstrings Hospice, and Bonnie Bowman, she is the community educator. Welcome to our show, ladies.
Yes, happy to have you.
Thank you.
Why don't you, Bonnie, what is your title again?
Public Relations.
All right, why don't you let our audience know exactly what your job is, what you do for the Heartstrings Hospice?
Well, within the scope of my practice, I talk to physicians, I speak to families.
Yes.
I go to churches, community organizations, and just educate about our hospice and hospice services in general.
I see.
Now, is there really a difference between for-profit and not-for-profit hospice organizations in terms of the services that they provide?
No. All hospices follow the regulations that are set up by the federal government. We call them conditions of participation, but we all follow the same guidelines.
But I know both of your backgrounds. I worked with you all in the community. I know, Sue, you were with another hospice that was a corporate hospice. And Heartstrings is a relatively new, about what, 5 or 6 years old?
5 years.
But it is locally owned. And it is more like a family type hospice. Tell me how you have viewed the difference between the corporate part and going to Heartstrings.
The difference for me was when we have situations that come up, because everybody's different. You know, everyone doesn't die the same. They don't have the same problems. When an issue comes up that we have to have an answer for quickly, I don't have to call corporate that's in Tennessee or Alabama or wherever, and I just ask the person that owns our company, or I can make that decision on my own and speak with him about it later. So it really unties our hands so that we can give the best care.
Is there a difference between the palliative and the hospice? The two,
There
are they the
is.
same?
No, palliative care is for patients who still want treatment. It might be a cancer patient who hasn't finished up their radiation, their chemotherapy, but you still want to focus on the comfort measures and have a nurse come and see that patient and help the family kind of get through the process. Hospice is for end-of-life care, and that's for when they have decided that there can't be any more treatment, wouldn't do any good. They've finished that. It's not giving up hope. You know, that's something that patients and families tend to think, that it's giving up hope. We never
And
ever.
that's good, because families need to know that, because they always think, oh, they're gonna die soon. That's why they're getting hospice care. That was the ad. The old adage that everyone had, you know.
And that, we're trying to change that. We're there for the
Good.
entire family. It's a team concept. We have the chaplain, the social worker, the nurses, and we're working on the spiritual, the social, the physical. You know, so it is a team, and it's for the entire family and for the patient.
Now, there is a lot of misconception about how long you can be on hospice. I know years ago when I started in the medical field, I think it was everybody like 6 months. But I know that there have been cases where people have been on hospice for 2 years or more. Can you explain that to the audience? Because that is a real misconception, and I think a lot of people miss the opportunity to utilize the hospice benefit because they think it's only 6 months, a week, 2 weeks. So explain that.
Well, the regulations actually state that for any diagnosis, if given the normal course of a disease process is 6 months or less. That is regulations. but only God knows how long a person's got on this earth. And fortunately, some folks really do better once they get on our program. Maybe it's the care and compassion that they get.
Okay, and we're going to take our first break, but I want to remind our audience, please go to our website at seniorconnections.tv, and we have archived our shows, as well as we have a lot of events going on, so take advantage of that, and we'll be right back.
Are your floors in need of a facelift? Shop at Floor Boys. We have the highest quality products, value pricing, and unmatched service. At Floor Boys, we treat you like family and provide an experience you cannot get at the big box stores. So please come see me, Brian, at Floor Boys.
Are you or someone you love having difficulty getting into the tub for a bath or unable to stand in the shower? Call Comar Products today for help with safe, comfortable, independent bathing solutions. We specialize in products like walk-in tubs and roll-in showers. Our walk-in tubs feature hydrotherapy technology, so your bath is always warm and may even increase blood flow circulation and reduce swelling. Call Comar today to schedule your showroom appointment or visit us at 1759 Airport Boulevard in Casey.
Don't compromise, mobilize with All Medical.
Enhance your mobility and independence with a van from All Medical. Choose from a Dodge Caravan or a Honda Odyssey and customize it for your needs. Whether you're slightly ambulatory or in a wheelchair, you'll enjoy knowing you can get around town whenever you want. You depend on All Medical to provide services and products to fit your lifestyle. Now call on All Medical to take you that extra mile.
Don't compromise, mobilize with All Medical.
Hi, I'm Henry Winkler, and I'm here to tell homeowners that are 62 and older about a great way to live a better retirement. It's called a reverse mortgage.
A reverse mortgage can give you tax-free cash, no monthly mortgage payments, and you still own your home.
Call Larry Reed now, your local expert, to find out if you qualify.
Ask for your free reverse mortgage guide and DVD, and when you call now, you'll also get this lighted magnifier absolutely free.
At Heartstrings Hospice, we are here to help. Each patient has a team dedicated to providing emotional, medical, and spiritual support. At Heartstrings Hospice, we will ensure the time that you have together will allow you to be just her son and you to be just her daughter, because you shouldn't have to be anything else. At Heartstrings Hospice, we are here to help.
Are your floors in need of a facelift? Shop at Floor Boys. We have the highest quality products, value pricing, and unmatched service. At Floor Boys, we treat you like family and provide an experience you cannot get at the big box stores. So please come see me, Brian, at Floor Boys.
Welcome back to Senior Connections. We are talking with our guests from Heartstrings Hospice. Now, Bonnie, what I wanted to, if you continue, telling us what the difference is now in terms of the care, why they may be with you, the hospice patient, a little bit longer than they were, say, years ago.
Absolutely. And as I said, that a lot of people do get better on hospice because they're getting all that wonderful care and compassion to just help them with their symptoms. Sometimes it's medication management. Folks sometimes are just non-compliant. So us being in there, being that liaison between their physician and their family is just a huge, huge benefit. And so some folks actually do get better on our service, and we end up having to discharge them until they do decline.
I was going to say, now, can someone be declined for hospice? Tell us about how that process works.
We go out and do an evaluation. We have an order from the physician. An RN goes out to do the evaluation and education visit, and Medicare has criteria that has to be met for people to be eligible for hospice care. So we're all knowledgeable about what that process is and what the criteria is. So we'll do that, and if they're not quite there, we still have our social workers. You know, they're calling because they have a need. So we still have the social workers contact the family and see if there's anything else in the community that can help them. Let the doctor know if we did or did not admit that patient to hospice services, and we stay in touch with them, you know, several months out.
Now, when you're talking about criteria, we all know what that means, but they don't know what that means. So give me some examples of criteria. Like, I know Alzheimer's, but it has to be at a certain progression of the disease. Now, what about cardiac?
Cardiac, it's end of life. It's the end stages of whatever that disease process is. Cardiac would be that they would be very short of breath at rest. That they've taken all the medications that the physician could give to them to make it better, and it's just not working anymore.
What about
oxygen dependent?
I mean, like COPD. End-stage renal disease. There are different diagnoses that meet that criteria, but it's not necessarily right when they're diagnosed. It's further along in the process. Okay.
Right, and the COPD, I think, is kind of one of the easy ones to diagnose. It really is. And oftentimes I explain it to the families as, you know, when you've got a loved one that's on 24-hour oxygen, and you know, if they can't get up and take a few steps without, you know, just really out of breath, even on oxygen, they're having difficulty maybe ambulating, walking, just to go potty or make a sandwich, things like that. You may want to give us a call, because we can help so much, because you know that we're about safety as well. So if your loved one can't get around the house to do the activities of daily living, the normal life things, then we can help those folks a lot. And they need to be able to be safe to get a shower and safe to eat.
So all your referrals are by physicians, correct? I mean, can an average family call?
They can call.
I didn't realize that. I thought it had to be, you know, only by physician's referral.
No, a family can call, and we can do an education visit without a physician's order, but we would, if it's going to turn into an admission, then we would need the order from the physician.
I know I'm going to get in trouble here, but I think that physicians sometimes can impede the process, because you have to wait for, you have to get a doctor's order to go on hospice, but the family can make that call. But sometimes I think physicians find it difficult to say hospice to a family. But anyway, I want to remind folks again, please go to our website. We have archived our shows, and there are lots of events, and please check out our sponsors, and we'll be right back.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
If you're looking for a fun new friend, what a day. Shelters are the best places to find one.
You don't say.
There you'll discover healthy, happy, loving animals.
Nothing but the best.
Waiting to become a part of your family. A person is the best thing to happen to a shelter pet. Be that person. Adopt.
We'll always be the best of friends.
To find out more, visit theshelterpetproject.org.
At Heartstrings Hospice, we are here to help. Each patient has a team dedicated to providing emotional, medical, and spiritual support. At Heartstrings Hospice, we will ensure the time that you have together will allow you to be just her son and you to be just her daughter, because you shouldn't have to be anything else. At Heartstrings Hospice, we are here to help.
As large corporations continue to take over local businesses, Carnegie and Mosley Funeral Home is still family-owned and independent. They believe that bigger doesn't mean better, and people always come before profits. That trust is earned, not bought. The Carnegie and Mosley family has been serving families since 1884. Carnegie and Mosley Funeral Home. They are your neighbors, and you'll appreciate the difference.
Woodash is having a mattress sale. Why pay thousands of dollars for a Visco memory foam mattress when you can get a complete two-piece queen set at Woodash for $3.99? This quality mattress layered with Visco memory foam features a cool, comfortable quilted top for a comfortable, cool sleep every night. Highly resilient, highly durable, and best of all, at a discount price starting at just $3.99 for the two-piece queen set. For the lowest discount prices featuring Visco memory foam mattresses starting at $3.99, shop Woodash today. Woodash, located in the heart of the Vista, 919 Gervais.
Welcome back to Senior Connections. We are continuing with our guests from the Heartstrings Hospice. Now, I want to know, in terms of how do they pay? Whether it's doctor referral or family referral. How does does insurance kick in? Tell me a little bit how that goes.
Most insurance will cover hospice, and we'll check that when we get the referral.
Yes.
Medicare pays for it 100%. Yes. There's not a copay. You're not going to get a bill from us. It goes from your regular Medicare benefit to the hospice Medicare benefit. Private insurances cover Medicaid, and we will. We have private pay or unable to pay. It's a service that we'll do. And if you're not able to pay, you get the same services.
I want to say, some people, where can hospice be provided? In the home?
Wherever the person is.
Wherever the person is. Okay. So they can get it in a nursing home, they can get it in assisted living, they can get it in independent living facilities, they can get it in home.
And in the hospital.
And in the hospital, okay.
I guess so, that's true.
In some hospitals.
In some hospitals, okay.
Right.
Not all.
We won't give you a list. But one of the things that I think is really a positive for hospice, aside from the fact that you have so many resources available, the nurse, the chaplain, the social worker, the fact that it covers the medications. A lot of people don't understand that. Can you explain that to us?
That is part of the hospice benefit. The medications that are covered would be comfort medications, medications that are related to their terminal diagnosis. So it's an individual. We look at them when we do the admission process. We look at all their medications and determine which ones are going to be covered under the hospice benefit. And we supply those for them. They can continue to get their other medications from wherever they've gotten them before, but we'll supply their hospice medications.
And what are the 4 levels of hospice care? Or aren't there?
There are. There are. Let's see, routine home care. It's routine care could be one. General inpatient could be in the hospital.
In the hospital scene.
Continuous care. And respite care.
You didn't know you were going to get a quiz today, did you?
Respite care. And respite care is for caregiver breakdown. It's when the family, and I always immediately key to the dementia and Alzheimer's folks, although it's not exclusive to them, that those folks, my heart so goes out to them because they are dealing with those folks, the families are dealing with them, our caregivers are dealing with the diagnosis 24/7. They go days with no sleep and no break, so respite care is just so important for those folks as well as others.
Well, we were talking earlier about the physicians, and I said sometimes they act as the impediment because they don't want to discuss with a family. Hospice, it's like it's perceived as maybe giving up, and that's not the case at all. So Sue, you elaborate on that a little bit and help me out here before I get in trouble.
You know, physicians, they are trying to help people get better. You know, they have that patient, the families all looking at them. You know, what can you do to help me get better? And so they do the very best they can with that, and then, you know, sometimes you just can't get better. And we are happy to have that hospice talk with the family, you know, for the physician. It's a hard talk, you know, and we're happy to do that for them. And we have physicians that rely on us for that. It's what we do. It's what we do.
I can speak personally because my husband had pancreatic cancer, and me being an RN, I was there with him all the time, so I really didn't need any extra help, as well as my mother-in-law. But I would have been lost without hospice care, mentally and physically, okay? It's just that they were there.
Okay. Well,
we'll continue afterwards. Okay. So.
We'll continue after we take this break. But again, and I apologize if I gave you some confusion earlier, go to seniorconnectionssc.com. That's our website. And please check out our archive of shows and those events. And we'll be right back after these words from our sponsor.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
Don't compromise, mobilize with All Medical.
Enhance your mobility and independence with a van from All Medical. Choose from a Dodge Caravan or a Honda Odyssey and customize it for your needs. Whether you're slightly ambulatory or in a wheelchair, you'll enjoy knowing you can get around town whenever you want. You depend on All Medical to provide services and products to fit your lifestyle. Now call on All Medical to take you that extra mile.
Don't compromise, mobilize with All Medical.
Hi, I'm Henry Winkler, and I'm here to tell homeowners that are 62 and older about a great way to live a better retirement. It's called a reverse mortgage.
A reverse mortgage can give you tax-free cash, no monthly mortgage payments, and you still own your home.
Call Larry Reed now, your local expert, to find out if you qualify.
Ask for your free reverse mortgage guide and DVD. And when you call now, you'll also get this lighted magnifier absolutely free.
At Heartstrings Hospice, we are here to help. Each patient has a team dedicated to providing emotional, medical, and spiritual support. At Heartstrings Hospice, we will ensure the time that you have together will allow you to be just her son and you to be just her daughter, because you shouldn't have to be anything else. At Heartstrings Hospice, we are here to help.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
Welcome back to Senior Connections. At this time, we have a new guest, and her name is Jane Richter. And Jane is going to tell our viewers a little bit about herself and how she is related to hospice.
Hello. I am the daughter of a man and a lady, both on Heartstrings Hospice. My mom died in 2010 and my dad died in 2011, and I couldn't have done it without Heartstrings.
So, how were you familiar with hospice prior to your mom and dad's?
I've been a nurse for 35 years, and I worked DHEC Home Health, and so I knew about the home health benefit, knew about hospice, but never realized how rich a benefit it is.
So true.
until Dr. Harvickson saw my dad after he got out of the hospital, and he'd had a stroke and a heart attack, and has Parkinson's and depression and you name it, just the litany of chronic illnesses. And Dr. Harvickson said, you know, Jane, what about putting your dad on hospice? And it was like, oh gosh, I don't want to go there. You know, that's just a hard thing. And but I knew it would help me. I was working full time, my husband was working full time, Mom and Dad lived with us. And I knew that I couldn't do it alone. And I didn't want to be the nurse. If Dad was going, I wanted to be the daughter, not the nurse. So he gave me this saint sitting next to me, Saint Sue, and she was with my dad. And in fact, she was with us at the end for both of them, which is pretty amazing.
Yes,
nice.
that is for the clinical director.
it
I
is.
commend you.
Thank you. Well, what actually do you do with Heartstrings now, Jane?
I don't, except talk it up every chance I get. My daughter-in-law, you know, called hospice when they needed it for her grandmother, and I just talk it up every chance. And I want people to know, I think so many people think that hospice is a benefit that you lose control. And you know, for people to understand, you can revoke hospice. If at any time, my dad one time panicked and called 911, EMS came, and then it was, but we shouldn't be taking her, but they called Sue, and Sue said, you do what, you know, Mr. Van Epps wants to do, and so they took Mom, they revoked it. And so the patient and the family still stay in charge of everything. I mean, I see him as a very consultative service that just makes it all bearable.
Was hospice what you expected it to be when you, I mean, I don't know how familiar you were with it, but was it what you expected it to be?
It was a lot more. It was what I expected in the beginning, but as Dad went downhill and more services got added, I mean, the social worker came in immediately, but towards the end, I had a wonderful aide that was bathing Dad and helping him every day towards the end. But she was in there for quite a while, helping a couple times a week. And we also had a chaplain, Brett, who was there and just sang to Dad, read the Bible to Dad, sat with me, helped me to deal with it. And they were angels. They were just angels. So no, I didn't know how good a service it was. I just knew that I needed help, Dad needed help. But boy, as it went on, they just put in as many services as you need to get through it.
Well, we are so thankful that you all came on today. And if you know someone who might need hospice, or yourself, and you're thinking about it, give Heartstrings a call and they'll be happy to talk with you. Before we go, I want to mention that the Carolina Classic Home and Garden Show is March the 8th, and they are going to have a senior day on Friday for those 62 of age and older, and you can get in free. And be sure and attend that because there are going to be other senior vendors there and they'd like to talk to you. Also, be sure and pick up your copy of Senior Living Guide. And again, go to our website at seniorconnectionssc.com and review our archive of shows and look at those events. They're for you, and we'll see you next week.
Yes, we will. And the Lord be with you.